like to call this work session of the Southampton Town Board to order on this 10th day of February, 2022. Please rise if you're able and join me for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Please be seated. Madam Clerk, would you please call the roll?
Supervisor Schneiderman,
Here.
Councilwoman McNamara,
Here.
Councilman Martell,
Here.
Councilman Bouvier,
Here.
Councilman Schiavone.
Here.
Okay, excellent. So we'll get started, and we're going to have a brief work session today. We don't have too much on, but we will go into executive session to discuss a number of matters. So I don't know if we're getting Ryan. Oh, Ryan is on this call, so we can bring him in. We might as well start with COVID. And I know there's been some recent changes. And I know Ryan has, I think, all good news to report, including the availability of test kits, and as well as the numbers that continue to change, and the governor's announcement yesterday about no longer requiring masks to be worn in indoor locations or most indoor locations. So let's see if we can get Ryan on. Charles, can you work on that?
Yep. Must be away from his desk.
All right, well, we can also switch and do some updates as well.
I'll try to reach out to him in the meantime.
Okay.
Jay, I just texted him.
Thanks, Ron. Thanks, Bob.
Yeah.
Okay, perfect. So, during this work session, we will do, that's all really we have. We'll do the COVID updates. We'll do any other updates that people may have. I could, while we wait for Ryan, I could fill you in on a couple things.
Jay, you might want to mention the S&P thing we did just.
That's exactly what I was about to say. So Len and I and Dorothy and Noah, who's our consultant, we presented to Standard & Poor's yesterday. We used to have to go into the city for this, but we're able to do this via Zoom. So whenever we're getting ready to issue bonds, we go to a rating agency, S&P typically, or Moody's, and we get a credit rating, so that, obviously the higher our credit rating, the lower the interest rate that we're likely to pay. So, currently we enjoy the highest credit rating. It's AAA. That's as good as it gets. Just obviously we just want to, since we can't get any better, all we can do is hope to maintain ourselves as AAA credit rating. So, we made the case as to why, since they've given us the AAA credit rating, that we've only improved. Our reserves have increased. Property values across the town have gone up. Crime has gone down. Crime rates have gone down. We have a lot of investments in infrastructure, a lot of obviously building of large, beautiful homes, but also things like the Canoe Place Inn hotel, which is $100 million investment into the Hampton Bays area, and some other large investments. And we talked a lot about what we're doing on resiliency, rebuilding our beaches, some of our energy policies. I know John's been very involved with those. And I think that to me, I think it went really well. They asked some really good questions, but our financial picture is extremely strong. And, I'm anticipating that, S&P will reward us for our financial management. We won't know until next week.
Yes.
Len, did you want to say anything else about our presentation to S&P?
No, but I'd like to say that the supervisor did a very good job, not to sound too saucy, but he is our chief fiscal officer and he did an outstanding job. He's been around finances and municipal finances for a long time and he knows all the buzzwords and he made my job very easy. So I appreciate having him at the helm.
Thank you. Of course, if they downgrade us now, I'm going to get blamed. So, so let's no. I think we're in pretty good shape. All right. Let's see other updates. You know, I serve as a commissioner on a state commission, Pine Barrens Commission, and Janice Shearer and Marty Shea are also sub for me on that commission. And things that are located within the Pine Barrens do go through that body for hardship waivers sometimes. And one of the projects that just went through was the Quag Wildlife Center. They're looking to expand. I don't know if you've ever been there. It's a really great facility. So they're looking to expand their main building and also looking for where they store their maintenance equipment. But they did receive a hardship waiver because they're located in the Pine Barrens. That was approved unanimously by the board. We also just closed the Mill Road property. I know that was outstanding for a long time. I know John had worked on this. We had put it out to bid a number of times. This is that property out in West Hampton that the town owned. We declared it surplus and we found a buyer for it. That closed the other day. I met with the new highway superintendent. We had a really good meeting. We talked a lot about chronic flooding areas, particularly tidal flooding areas, sea level rise, and how we can address some of those flooding problems. We talked a lot about traffic and congestion and how we might approach some of those issues to help alleviate some of the back road traffic. And so it's really we're really off to a very good working relationship. Rick will be the highway liaison for the year, and he'll be at those meetings in the future. But I'm very encouraged so far working with Superintendent McCardle, who's now been through a pretty major snowstorm, so which he handled quite well. I did sit in on a meeting on FIMP, the Fire Island to Montauk Point project. It's sort of moving forward slowly. It was a highly technical meeting. Jim's very close to this and Aram is very close to this. And we are gearing up to start figuring out exactly where, what lands will be needed to place the material, the sand on. We have to appraise the easement area. We have surveys involved. It's a very complicated project. I'm glad Jim is doing it and not me. It's a lot of work. Jim, we haven't hired anyone per se to help with that process. So your staff is sort of on it. Do you want to say anything about FIMP and how that's going to affect our?
Yeah, right now, that's true. Mostly Kelly Doyle in my office and myself. I put on notice to everybody else in the office that they'll be available as needed. I think I'll probably recruiting Mark as well. Kelly and I have met with the county. The county's been living with this for the last 8 years with the Fire Island project. So I've been really trying to go to school on the issues that they faced and the experts they used. I'm very, very familiar with the experts they've used from my time at the county as well as my time at the Attorney General's office where I did all the condemnation work there. We use the same professionals, the same appraisers, the same surveyors and whatnot. So we're really just trying to get ahead of it as to understand and anticipate the valuation issues that may exist when we have to take the easements. So obviously, hopefully for us, it's only going to be temporary work easements. That hasn't been 100% confirmed, although I believe will be the case. There'll be hopefully a little bit little bit simpler, or at least a little more cost effective.
Hmm.
But as I said, I've been speaking with the county folks, and the only person really been kind of involved from the outside so far is Gil Anderson, who, you know, obviously was the former commissioner of Department of Public Works with the county. Excellent professional and human being. And Gil's been working with us a little bit. He's with LK McLean now. We're fortunate to have him on the team. And he has the experience at the county level. So, and he at the county, he worked both with the state and the Army Corps. He has those relationships already. And so I've been picking his brain as much as I possibly can as well. So
Right.
we'll hopefully be there, be ready to go when the starting gun goes off.
So yeah, thank you for that. I guess we're still looking to try to get Ryan on. I'll say a word or two about COVID. Obviously, it's still here. People are still testing positive. The local rate, I would say around 12 cases a day, 11 or 12 cases a day, a lot less than we were. You know, we're on a trajectory that's moving in the right direction, that we'll see less and less. We did, and Ryan, if we get him on, we'll talk about this, but we were able to secure a lot of test kits, a lot of these like 15-minute test kits from Suffolk County, a couple thousand of them. And we have we're going to distribute them to all the villages throughout the town of Southampton, into some key locations. Ola will get some. Ryan put together a distribution list that I reviewed, and I thought it was very well thought through. So we will have plenty at the town as needed for town employees. We're going to make them available to others outside, in the public as well. So we'll set up some distribution so people can get free testing kits. So Ryan will be in charge of that distribution. The governor did announce yesterday end of the mask mandate. I'm sure you all heard that. So in terms of the town policy, that's it. So we have the right to continue requiring masks, but I think it's time to no longer require it, to go back. So if back to what we had before the mask mandate, if you're not vaccinated, wear a mask. If you want to come to town hall, you're not vaccinated, you should wear a mask. But we're not going to be checking vaccination cards as you enter. We just expect that those that are not vaccinated would wear a mask to protect themselves, and everybody else no one else will be required to wear a mask. But we will have signage around town hall and other town buildings. But we're going back to where we were prior to the governor's mandate. So I'm personally very happy to see that. I think it's nice to see everybody's smiling faces, all smiling because they don't have to wear the mask. So that's all good news. All right, why don't I kick it to you guys? You guys have any updates, and we'll try to figure out why we can't get Ryan on.
I'll start off for you, Jay. So the Parks and Rec Department is in full swing, looking ahead to spring and summer. They are working on their summer programs, their concert series, and preparing the beaches for the season. You should follow them on social media, check the website, and also, check your mail for the brochure for all the programs for the spring and summer. The Youth Bureau on Tuesday night had an event at the Parish Art Museum. It was called The Visual Conversation. The group in the room started an art project, did about 10% of it, and passed it along to see if their message as it went around the room could be fulfilled through art. It was a pretty interesting night. It was very quiet. They did their art projects. In the end, they spoke whether the message came through or not. It was nice. They also have, coming up with the February break, they have their winter break programs at the Flanders Youth Center. It's for kids K through 8. And on Fridays through April, they have basketball clinics in Flanders for grades 7 through 12. So it's something that if you have a kid in school, you really should follow their website or their social media. They have some really nice events for the kids. Thank you.
All right, thank you, Rick. All right, any other updates?
I'll weigh in quick if,
Go ahead, Cindy.
so I'm just about a month, just over a month in now. And I have to say that I've been actually coming into town hall regularly just to put, faces to names. And there hasn't been honestly anybody in town hall that I have dealt with that hasn't gone out of their way to help me, to make sure I understand how their departments work. And then we just got our legislative assignments and going through those things. I was able to meet with Liz Dwyer at Senior Services, and the amount of programming that we as a town have available for our seniors is really quite amazing. I mean, down to if you're a senior and you need, a handyman to come out and put in a grab bar for you, we have somebody that will come do that. I think it's services that need more outreach to let people know that we have this available. On the Dark Skies Committee, they are doing PSAs for Sun 20 TV to culminate on Dark Skies Week. The Disability Committee, which Jamie Bowden and I are working on getting back up again because they were only meeting in person, so they haven't been meeting. But with that committee, we really want to reach out to and include those with developmental disabilities because they haven't been included really in the past. I mean, there's so many things I can get into, but Addiction and Recovery and Behavioral Health Committee, they actually on Monday are opening a new Thrive Center in West Hampton Beach. And I'll just read it to you quickly because they put it way better than I could. Thrive's mission is to help individuals and families find, maintain, and strengthen their recovery through peer-based support, navigation assistance, and referral services, provide interactive educational programs that promote wellness, economic prosperity, and civic engagement, and maintain a safe, welcoming haven for substance-free recreational and social activities. And this is in partnership with Hugs and Family and Children's Association. It's amazing because the next closest one is in Hauppauge. So it's really great to have one of these centers out here on the East End. They are set up for amazing programming that will be open to the community. It's right on Mill Road in West Hampton Beach. And it's a great addition to our community. You're muted,
Jay.
Jeff.
Muted.
Oh, sorry. So should we, thank you, Cindy. Should we jump to Ryan and then we'll come back and finish up updates? If that's all right. Yeah, I stalled for a little while, Ryan, but thanks. I'm glad we were able to get you on. I did mention, the governor's announcement. I did mention the test kits, but I didn't really have the numbers and the distribution list or any of that stuff. But and I did talk a little bit about not the positivity rate, but the number of cases trending downward. So, but if you, I don't know if you're able to hear any of the things that I said, but if not, just give us a quick update on COVID matters.
Yep, sure. Thanks, Supervisor. Sorry, I wasn't on just a little while ago. The numbers are trending good for us right now. We are down to about a 10 new positive per day increase in the town of Southampton. That's a significant drop. If anybody recalls, from like 2 weeks to a month ago, we were looking at in excess of 250 a day, and those were just the Department of Health numbers without any of the at-home tests factored into the quantity. So in reality, we had our best guess that we were probably somewhere in the 350 to 400 range, possibly based on what we were seeing with spread and everything else. So we're at 10 a day new positives is our 7-day average in the town of Southampton right now. As of about 48 hours ago or so, in my conversation with the hospital, they were at 9 COVID patients within the hospital, with only 2 of those 9 being in ICU and none of them on vents. So that was a really good trend too. Again, reflecting back a little bit to try and give it perspective. 2 weeks to a month or so ago. I think they were somewhere around the 25 to 26 range in terms of, COVID census in the hospital. And there were people that were on vents at different points during the Omicron surge that we were seeing, which thankfully, appears to be tapering off. So they're down a lot too. The demand for testing is down a lot too right now as well. Red Creek Park's most recent numbers have been, again, they're still open on Mondays from 10 to 6. But their numbers more recently have been at 50 or less tests on a Monday. And that is down from, I remember the number quite distinctly because they got a real wave of people that came that Monday after New Year's Eve weekend. They did 560 tests that day, the first Monday after New Year's Eve. So we went from 560 that Monday to 50 or less now on Mondays. So across the board, you can see between the positive numbers, the hospital census, the demand for testing, we can really, really clearly see that we've seen a big drop off. And I think the testing, as I mentioned on the board meeting the other day, there's a couple of factors there. Thankfully, the spread has gone down significantly, which is what we thought would happen. What the medical professionals told us would likely happen is that by the end of January into the beginning of February, we would have peaked out with the saturation within the population based on how many people per day were getting COVID, and that we should see a fall off. And we're seeing that fall off right now. I think people that are testing at home, and the county has created a mechanism that you can report positive testing in through the website from home tests. So it's putting less of a demand on some of the facilities and testing sites. But then a lot of people that have to either test or vax for work, one of the other conditions that some employers have is that, in lieu of a negative test, if you show proof of recovering from COVID within the last 90 days, that's another mechanism. So I think a combination of those factors is leading to that drop off in demand at the local testing site that we're seeing. And I know that the hospital has seen a drop in that demand for testing as well. I think it's a combination of those different reasons that we're talking about. That said, and as a tag on to the comments with regards to, at-home testing and the ability to report in now, which hadn't been in place at the beginning of the surge. So we had a lot of people that were getting at-home tests that then, for the purposes of employment or school, still had to go to a facility and get some sort of an official printout test because the county health department hadn't created a mechanism on the website yet to file your testing results with them. That said, we have acquired, thanks to the county, 2,500 test kits that we will be working over the next 2 weeks to distribute out around the town, through the town, and the incorporated villages within town. We have a plan that we have developed that we will be announcing within the next couple of days with regards to how we're going to handle the push out of these tests. It's 2,500 kits. Each kit has 2 tests in it. These are truly at-home testing kits, as opposed to what the county had previously given to the town, which were kind of like bulk testing kits that we could conduct, but it was 1 bottle of solution for 40 tests. So we really kind of had to do them on site, and it was for a lot of our employees that had more exposure to the public. These are at-home kits, so we will be sending them home with people. We plan to use some of our partners in the non-governmental sector through maybe some faith-based organizations, organizations like OLA. We have an obligation to share some of these with our villages. So we have a plan to distribute them, a quantity to each of our villages within the town, senior services, a variety of different mechanisms of putting them out, along with we intend to open up some actual distribution sites where for a period of time during a day, kind of on a first come, first served basis. We can give out up to a certain quantity of tests in that spot. And we'll geographically spread those distribution opportunities out throughout the town. And we'll also do it in a way that accommodates both daytime availability of individuals and evening availability of individuals to account for people that have to return home from work at the end of the day. We don't want them to be excluded from the opportunity to be able to come out and get a kit if they would like to do so. All of this is, of course, happening at the same time that many people have gone onto the federal government's website to request some at-home kits too. So what I hope we face within the next, few weeks to a month, and certainly going into our busy season, is that people have much more readily available testing kits for their own use at home, and that the demand on the system has gone down significantly. All of the medical conversation that I've been privy to seems to suggest a favorable outlook from medical professionals with regards to the combination of number of people that have now been vaccinated and the number of people that have developed at least some level of natural immunity from having recovered from COVID themselves. So I hope that we don't keep looking at new variants of this virus, but even if we do, I'm hopeful that we're in a position now where our population more holistically is better protected than we were even when the vaccine rollout had been conducted and been successful. So I think we're in a good place, and I would just say stay tuned. We expect to have a notice going out, a press release going out with regards to the distribution and the plan for distribution of these testing kits within the next few days, so that people can plan accordingly and take advantage of some of those opportunities if they would like to get their hands on some of those kits.
All right. Anybody have any questions for Ryan? Thank you, Ryan, for that.
No problem.
Any questions? All right, excellent. All right, so let's go back, finish up board member updates. I think Councilman Scavone, you had your hand up before?
I did. This morning in the town of Southampton, we had a bit of a milestone. We had a wall raising celebration over in Flanders. This is one of the 72H properties where houses are being erected. And that is in conjunction with our Southampton Town Housing Authority, as well as the Habitat for Humanity. So the first of 3 structures on that property has the walls up today. It was a great little event, a lot of people there, well attended, and it was also attended by the new owners of this house. Shalisa and her family and her kids were there working on the project as well. So it was a really fantastic thing. It's going to be good for the community there as well.
Right. Excellent. Any other updates? I think John may be speaking. I'm not sure. John, you need to unmute.
I lost my internet twice. I don't know what's going on. That was my fault. I just wanted to thank Cindy for mentioning Thrive. They're having a ribbon cutting. I'm not sure if you'd mentioned that. The ribbon cutting's at 11:30 in West Hampton Beach. It's a great organization. Just a quick update, because I know we're really behind. We've met with all the stakeholders for the West Hampton Beach Community Center. And lots of thanks to our new town engineer, Tom Houghton, and hopefully we will have Nick Jimenez will be joining us as a capital projects manager next week. So we're getting much closer to being able to start to actually do the modifications we do need to make to the building. We've met with all the stakeholders. In particular, I give a shout out to the American Legion. Tom and I walked them through the building and got some great input. And so everything's going pretty well with that. Also meeting with the county commissioner for DPW and other elected officials on establishing crosswalks for the Andrew Spilka Park, which is one of the things that's been holding up the dedication to that park. I hope we'll have a successful resolution with that meeting. And just quickly, have had several meetings with the governor's reps, particularly on energy issues, and very, very positive meetings, particularly in ability to help support some of our initiatives, both financially and conceptually for what we're proposing to do. This is a lot more, but I'll leave it at that right now, because I know we're almost an hour over. Thank you.
All right, thank you, John. All right, anyone else?
Yeah, I'd just like to quickly announce that there is a community advisory board meeting tonight at the Horseshoe at Riverside. This is a county meeting with issues regarding aircraft noise in and around Gabrisky Airport. We will have a representative from the FAA there, and that starts tonight at 6, and there will be public comment.
I'm sorry, could you tell me where it's being held?
At the Marjorie Postal Auditorium. I think that's her first name.
Maxine.
Maxine.
It's the
Maxine.
Riverside Center, the Riverside Center.
And yeah, it's at the Riverside Center. It's the same building where the county clerk is in. So
Maxine
in front.
Postal. Maxine
Yeah.
Postal Auditorium.
It's where the legislature meets out east.
Right, like I said, at the Horseshoe in Riverhead. Yeah.
Right, but not technically Riverhead, but yes.
Riverside.
Yeah, Tower Town, actually. Yeah.
And also Sunday, there is a announcement of that meeting, and the details should have come out of the AC West. If you didn't get it, I can forward it to you.
If you would, please, because I had a few constituents call in that were interested in attending.
Sure.
But I didn't have the exact location.
Okay, thank you.
Thank you so much.
County Center building, first floor.
Thank you.
Okay, any updates from any CACs that we need to be aware of as a board?
The only one I have is for the North Sea CAC. The community had a lot of questions about the community solar program at the North Sea landfill. And Frank Sapone came to their meeting this week and did an amazing presentation. I mean, he spent over an hour really going through the project and answering everybody's questions. And I did get a feeling at the end of that meeting that everybody was very appreciative that all of their questions had been answered and addressed.
Excellent. That's great. That's an exciting project. I know there's some conversation with SYS now too about possibly solarizing the roof of that building and sort of tying it into that project. I don't know the status of it, but Frank had mentioned that.
One of the benefits of a project like that, this is a pilot, and we fully expect to be able to do similar things across the town where it makes sense over landfills or on brownfield sites, is that part of the money that we realize that is for additional sustainability projects. And one of those is hopefully put a lot more solar on town properties and town rooftops and town facility rooftops as well. So it's sort of a cascading system. That's what we hope, that the money realized from that doesn't come from the town. It actually comes from the developer. And that's the exciting part of these projects. Hopefully it will be able to move quicker than as slowly as it sort of takes to get this first project going. We can get some more going, but we'll learn a lot from that project. But there is money that comes out of that, not only helps people on fixed incomes in the local areas to reduce their costs, but also provides sustainability money for us to install things like EV chargers and solar panels and all those kinds of things. So I'm excited about the future of this CDG, it's called.
Okay, so if there's no other updates, then let's end our work session. We'll go into executive session. We'll start via private conference call, but we will then go back. I think there is a Zoom for the, I think the land acquisition section, or maybe it's for the acquisition and general section.
with the Village of Southampton matter, really just the rest of the acquisition issues are all by the exec session. I think we just have a Zoom concerning the matter involving the Southampton Village.
Okay,
Yeah, that's scheduled for 1:30.
Yep,
is that 1:30?
1:30.
that's it. We have that scheduled 1:30 now, right? We're about a half hour beyond our schedule now, so it might be a little bit later.
Okay. All right, so let me make a motion then to end our work session and go into executive session to talk about personnel and talk about land acquisitions. I think that's all we have. So we have a second by Councilwoman McNamara, all in favor?
Aye.
Aye. Thank you. We are adjourned for all other purposes.